everyone, and welcome to our webinar today, which is entitled Equity's Role in Social Determinants of Health Interventions, Data Democratization. My name is Artia Rogers. I'm the moderator of today's webinar. And here at Health Leads, I serve as Director of Programs for our California portfolio of work. Now, for those who may not be familiar with Health Leads is an innovation hub that runs both national and local initiatives that address the deep societal roots of racial inequity that impact our health. And during COVID-19, when we've seen Black, Brown, and Indigenous communities disproportionately impacted due to structural racism and white supremacy, Health Leads work has focused on helping communities both respond to immediate essential health resource needs and rebuild equitable systems for the future. And as we begin to rebuild systems, we must ensure we are not replicating or reinforcing the deep inequities in how those with health, justice, and educational systems operate, and we need to intentionally and explicitly uplift racial equity. So this leads us to our topic today, data democratization. Well, The Economist has described data as a commodity whose value actually rivals that of oil. Some sources even argue that data is more valuable than oil. Either way, we have seen the commodification of data in our society by some of the biggest digital titans like Google, Amazon, Apple, Facebook, and Microsoft. However, data commodification has actually moved beyond these titans as well. Even in our industry, the social needs or social determinants of health sector, we have seen how much data has controlled how the sector moves forward. Sometimes that's a good thing, and then sometimes one must wonder if the social determinants of health interventions are more focused on the newest technology and the data that that technology produces, or if we're more interested in data that health systems and other research institutions are most interested in, instead of the data that aligns with community interests and helps meet the needs of the community or uplifts a community agenda. Especially in this time of social unrest, political activism, and a call for organizations and institutions to have an anti-racism agenda, we must continuously interrogate how our approaches to social determinants of health interventions consciously or unconsciously contributes to systemic racism and oppression. Therefore, even with data, we must ask, how is the data being used? Who sees the data? Who evaluates and interprets the data? And even who benefits and who is harmed by our data collection, our evaluation, and our data interpretation. The imperative to understand this concept of data democratization, especially for us in the social determinants of health sector, is vital, as all of us could very well be at risk of doing well-intentioned work, yet contributing to the systemic oppression of others, particularly the people that we want to assist in health. So that's why we're having today's discussion. In today's discussion, we'll be hearing from 3 health equity champions, and we will learn more about data democratizations and ways this approach can be applied in an anti-racist way to our work. So let me introduce our panelists. First, we have Dr. Amy Carroll Scott, who's an associate professor at the Drexel University School of Public Health. We have Dr. Sheena Nam McKinley, who is the Vice President of Research and Development here at Health Leads. And we have Enrique Valencia, who is the Project Director for Orange County Environmental Justice. So I'm really excited to be speaking with you 3. I just wanted to start us off with some level setting. And Sheena, if I can start off with you, I would love to hear you describe what data democratization is and why it's needed and why you think it's important.
Thanks, Artera. I'm really excited to be here and just be in conversation with all of the people on the call today. I think in its most simplest terms, data democratization is the idea that people own their data and the stories that come from the data, and they drive the change they want to see using that data. And do you want me to talk a little bit maybe about why it's so needed?
Yeah, if you can just expound on like why is that an important concept? Why is that needed in today?
Yeah, I mean, I think certainly historically, and it continues to present day, a lot of people have not been able to own their data or tell the stories they want to tell from that data. And what I mean by that is, across my career and just also in personal life, having been in public health, education, community-based organizations, and being fortunate, right, to be in circles where people were interested in addressing injustice and social determinants of health. There were lots of great intentions, right? But because of that interest, there is necessarily, and rightly so, a focus on where the health inequities lie, right? Where the health disparities and the outcomes are, have gaps. And so because of that, there's always this interest in Black, Indigenous communities of color. And because of that, there's constant sampling, right? Constant surveys, participation in data networks, care coordination networks, screenings, assessments, all of things. And so there's so much information being collected, and sometimes, oftentimes, perhaps with good intentions. And yet, as all of that is happening, it's continuing to perpetuate this divorcing of people driving, like the categories, the construction of the tools for data collection, knowing, what's being done with my information. Do I get to consent in and share who gets to see it, at what times they get to see it, in what ways they're going to use it, and then the narratives that all come out of it, right? And I think, there have been long histories of data extraction in these communities, so it's no wonder that nobody, or not nobody, but a lot of folks would be hesitant to participate, would be what I heard really aptly described as system leery and system weary in terms of data participation and data sharing. And so I think, given the times that we're in, the speed of technology, the framing of everything that's been moving at a fast pace with COVID, and really the time to be able to barriers, that none of that can be done if all of the processes for data leveraging systems change and addressing racial inequities are still rooted in a lack of self-determination.
Yeah, thanks for sharing that, Sheena. It seems like, something that you really were emphasizing that grabbed my attention was this: we often extract data from the same people, divorce them from the process, and we don't even allow them to interpret and have control over the data narrative of data that is about them. And Amy, I would like to bring you into the conversation, just ask you, have you seen that? Is this why you feel like data democratization is really important? Love to hear your thoughts on that.
Yeah, I mean, I couldn't have said it better than Sheena, except to say that I have very serious concerns about whether or not the data that is extracted from those communities is valid. If it's not engaging those communities in the process of planning for the data collection, or the use of the data to benefit the community, if they're not participating, then I would argue that that data is likely not valid. It's likely not representative, and it's likely not valid. So, I get concerned about this, and I'm sure I'm preaching in the choir on this webinar, but, data is power. And the evidence that's generated by research, that data is used to document the very inequities that we're talking about, to frame those debates, to inform advocacy and mobilize around that advocacy, mobilize change agents, and to plan and evaluate the effectiveness of proposed solutions. So, those who drive the research agenda drive the systems of community, social, economic, health, and educational supports. And so how is social change possible if the research and data that drive these efforts aren't led by those same folks who live in the communities being studied? I say that that's impossible. And so data and research that isn't representative and doesn't reflect that lived experience is not only not valid, is not only not participatory or equitable, but it's actually not going to work. It's not going to create the change that we're hoping the data is going to create. And so, you know, a lot needs to happen if those communities are going to trust data and research processes and really become involved.
Yeah, I mean, you kind of took it a step further. You've been questioning, like, is that data even valid if there's no community participation involved in the process? And also really talking about how you really started to address some of the harm that can happen by not including community too, because these institutions have this ability to drive an agenda, drive how work happens, who's involved, who benefits. And, you know, I feel like you've called out a warning as well. Enrique, I know you do a lot of work in the community and really, you know, you're responsible for making sure that there is community participation in data collection processes. And I just wanted to know if what Sheena and Amy, what they were saying, does that resonate with you?
100%. And I would invite two perspectives when looking at data democratization. So I do want to acknowledge that with the first perspective, there is a history and a legacy of harm that has been made towards a lot of communities that are often studied and where there's data that's extracted from them for various research projects. And, you know, the harm is rooted in hierarchies and systems of domination, where we actually fail to take communities into account as equal stakeholders. And, you know, when I say communities, I'm really talking about Black, Indigenous, people of color, folks who are often low income and may have low education privilege. So, you know, right there, when we start to think of the most impacted, we see that there's a level of privilege that, or I should step back and say that there's a level of overlooking of systems of privilege that play out when we're engaged in research projects. From my organization, the other perspective that I want to invite is that data democratization can also be a powerful tool that can serve the broader project of liberation. So, you know, I have my roots in community organizing, and the work that we do at my organization is doing community organizing in service of environmental justice. So community organizing implies that you're actually working with, not working for, but you're working with. So that implies a horizontal relationship, meaning that the people that you're working with have all of the say when it comes to shaping the agendas, the collective agendas that ultimately will shape their lives. So, you know, I would offer that data democratization, it's complex because we're in a point in a society where we're seeing tremendous political uprising with Black Lives Matters and police brutality and other movements that are cropping up. And, you know, I think we should pay attention to this moment because this moment is telling us that we really need to examine the structures of hierarchy and domination that have resulted in inequities. And so, you know, our contribution as an organization to the broader movement for social justice and the breaking up of hierarchies, or the dismantling of hierarchies, I should say, is to really use data in a way that's tied to liberation, to justice, to systemic transformation. So I'm happy to talk more a little further into the webinar about what that looks like specifically, but as a community-based organization, we actually employ a model of community organizing that's tied in with scientific methods, which we call our community science organizing approach. And the parts to that approach include community input, environmental testing, community academic partnerships, generating peer-reviewed data, and also leveraging that data for change through various community organizing strategies.
Enrique, you gave us a whole lot there and a lot to chew on. And one thing that you really had me thinking through is this tension that can happen with, the historical harm that's been present with data extraction, and then, but also this hopeful aspect of data democratization that can be used for liberation. And I want us to stay there for a little bit. My next question for you all is just, how does data democratization lead to power shifts and changes in racial inequity? And Enrique, you really started talking about how we have to be mindful, I think, even of this question in this particular moment. And Amy, would love for you to kind of start us off with that.
Great. I mean, I think if we're going to think about dismantling or transforming these, systemically racist and, sort of historically harmful systems of power, we really need to think about what those systems of power are. And when we're talking about data and research, we're talking about academic and research institutions, government agencies, and large medical institutions, of which many of us are a part of. I think Sheena talked about intentions. And intentions are important. Those agencies, those institutions, for the most part, at least a lot of our own experience, have good intentions. We want to eliminate racial and socioeconomic inequities, right? We want to make changes. And we're surprised at why it's not working. And it's because the systems that created those inequities in the first place are the systems that keep perpetuating their own privilege and power. We have to examine, especially in this moment, how despite our intentions and our focus on eliminating health inequities, we have to think about how we perpetuated our own power and privilege in these kinds of institutions. We've invested in our own systems. We've invested in systems of government and funding that reward those kinds of institutions and prioritize their technical and scientific expertise over the unique and important expertise of the lived experience of the community members in those communities that we most care about, that we're talking about. And so these systems have long disenfranchised these very same poor and minority communities in which they intend to do good work. They tend to still treat them as subjects of research and not as equitable partners in research, despite the fact that they bring such unique and important expertise to the research and the data enterprise. And of course, that compounded with the history of abuse and mistrust. Community residents and community-based organizations feel this power imbalance. And it's hard for them to catch up. It's hard for them to get those grants, to be the lead agencies, to be the experts in the room about the research questions and the methods of data collection in their own community. So, I do see democratizing data as an essential and important paradigm shift for, equaling this power imbalance. It's so that communities can drive the data and research process, as we've already said, so that the data is in their hands to drive the social change they want to see, and to frame the narrative around that.
Yeah, just wanted to see, Sheena, if you had questions or any thoughts expounded on what Amy was saying about just seeing how this can be used to shift power dynamics and also recognizing the place of privilege we have in these institutions.
Definitely. I'm like just nodding so vigorously every time Amy and Enrique are speaking. I think one of the things that really resonates with me that Amy was sharing was the ways that these practices, sometimes we talk about power in these very sort of big conversations, big necessary conversations, but they are rooted in everyday practices, right? In the way that people are given credits for tenure, or how grants are funded, or what the definition of evidence-backed practice is, right? And who gets to say when something qualifies as evidence and because it was published in, something behind a paywall, right? And so there are these very nitty-gritty, in the weeds kind of details, what I call sometimes like too mundane and bureaucratic for, I don't know, like a keynote speech or something like that. But that's where power lives, right? And that's where power needs to be interrogated, like in everything we do. And, you know, just to throw out a couple more, like what power shifts could look like is in governance structures where community residents are part of vendor procurement review, right? If it's like looking over what technology platforms will support care coordination, you know, and I don't know if this sounds radical, but it's not, because I've been in spaces where I've seen community residents that were part of an RFP process, right? And I mean, it took work, right? And I think funders had to come along for the journey, but they were part of, you know, a call for proposals, and then got to look at which agency was chosen and would be most trustworthy and representative, right, in guiding a collective impact project, right? And so there are ways to think about shifting power and ceding power and making sure that the people most impacted are driving those decisions in some of these bureaucratic details, right? And changing definitions of what counts. Something we're doing even internal to our own research and development team is looking at our citation database, right? Which is, you know, what we use to make sure that we're up on the literature, and that's what we cite when we, you know, share out lots of things, and looking at who are the authors, like where is not just the topic of the research, but who is being credited with sharing these stories, making sure that the citation database goes beyond peer-reviewed literature to include really important, you know, public white papers or other formats that are actually more meaningful and accessible to community residents. So, I mean, those are some very concrete, perhaps micro-level practices, but I think that's where I get really excited, because these big conversations around power shifts can happen if we start to pay attention and push for accountability in a lot of these day-to-day kind of standard business or standard operating procedures.
I love that. I think a lot of times we don't really step back, as Amy was saying, and understand like what we do to contribute to furthering systemic racism or systemic oppression. And Sheena, I love how you are, you know, talking about some of the things that we may think, you know, we may think it's small, but it really starts shifting the mindset once we start understanding, like, okay, who are we citing? Who are we referencing? And I think that that's really important. And I'm wondering, you know, because it seems like an inside-outside game that has to happen. You know, there are things that you have to do internally. I think looking within the community, Enrique, I'm wondering what role, you talked about this some, you know, what role do you see data democratization playing in changing some of these power dynamics, changing some of these, or breaking down some of these barriers that contribute to racial inequity, especially when it comes to data?
Absolutely. So the work that we do at Orange County Environmental Justice is political, and it coalesces around government structures, county government structures, and also local city structures. So I am actually a little bit more cynical, maybe not a little bit, but I'm cynical about, on the one hand, about the question of how data democratization can lead to power shifts based on the experience of working in Orange County and really trying to engage people in positions of power and government to partner with communities that are being poisoned, for instance, around lead toxicity. You know, really just pleading with them and trying to get them to allow us to have decision in processes that our state mandates require community engagement. You know, we're talking about the bare minimum. We're talking about following the law. And even in those instances, there's still power imbalance and various inequities that play out. And I would be remiss if I did not mention the political angle and, frankly, you know, the corruption that exists in a lot of local governments, where the most impacted community members are often easily disregarded when they go to city council meetings, for instance, you see blatant disrespect of their voices. You see government officials on their iPads or iPhones, not really listening to data that may not be peer reviewed, but it's data that comes in the form of testimony and lived experience. So I think there's a lot of work to be done. There's many layers to this question. I just offer one as an anecdote, but I also do believe in theory that data democratization can lead to power shifts. And the way that we're committed to that vision is by making sure that we're placing the most impacted people, again, the people that we often research when we talk about social determinants of health, right? So the people who are experiencing the worst outcomes, really partnering with them as equals and bringing them at the table, not during the research project, but at the planning stage, right when you're writing the grant application to the National Institute of Health or the National Science Foundation. That's really when you need to start bringing in the community, not when you got the funding to go study them. That's not how it works. So that's one way, and also allowing them enough space and power when they're at the table to actually set the agenda and inform the process from beginning to end. So again, I'm cynical just based on the political experience that I have, but I firmly believe that the vision can be achieved. Again, we have to look at the fact that we need to address power imbalances, and for us, we're very fortunate in that we have a community organizing approach, because the basis of that is really upending power to meet the collective needs of communities that are being the most impacted. So, again, I'll say that we've had an experience of applying for funding. I'll talk about soil lead in a couple of minutes, but another project that we do is around water quality. And when our organization was first formed back in 2016, we made a point to go to the census tracts that have been identified as the most pollution burden. And we asked over 4,000 households. We had folks who were interviewing people in English, Spanish, and Vietnamese. And we asked them, what are your top environmental concerns? And so overwhelmingly, communities told us that water quality was a top concern. We have been engaging with water managers who are often middle class, white, middle-aged males, and there's a perception that the water is safe to drink. We don't know what you all are saying. So again, it's we're uplifting this knowledge, but the system is not prepared to actually address what the community is raising up. And in full transparency, we applied for funding under an initiative that voters of California passed to support community engaged water infrastructure improvement projects. And we were like one of two organizations that weren't granted or weren't accepted into the funding pool. And interestingly enough, those that did actually get the funding were cities, even though the option was open. The application was open to nonprofit organizations such as ours. So again, I think we have to look at the systems and who are the people that are working within the systems, and what are their priorities and how do they view community input and community knowledge.
Yeah, I really appreciate that, Enrique. When you started talking about centering the affected populations, you talked about the government and their approach to wanting to have community engagement efforts, but not necessarily doing the work necessary to reach the affected population. And I think that happens a lot. I can tell you about countless health systems that have patient advisory councils that sometimes don't even reflect the community, or definitely don't reflect those who are most harmed by the healthcare system. And I think especially if we're going to do work that's targeting the social determinants of health, we have to be just intellectually honest that a lot of the people that we are talking about are from the historically underinvested and underrepresented communities like Black, Brown, Indigenous. And if we're not centering those perspectives, we have to question, are we doing this work right? And so I want to ask you, and I know you talked about the soil lead study, the water study, but, how did you overcome the challenge of getting people to actually hear community voice and understand the power of community voice? Because I think that's a challenge that you said that was present in that work. So would you mind delving into that a little bit, Enrique?
Absolutely. And I think that's one of the central challenges in community organizing projects is really trying to get the people with power to listen to the most affected. So it's an ongoing objective, but I do want to bring in the example of our soil lead study. So back in 2017, there was a publication that's called Think Progress. Some of you may be familiar with it. And they conducted a study of soil lead levels across the city of Santa Ana, California. So Santa Ana is a majority Latinx city in Orange County, so in Southern California. Orange County itself is known to be very wealthy, has some of the most expensive real estate in the country, but Santa Ana itself, it's kind of like a tale of two counties, right? Where you have your Newport Beach, your Southern Orange County, and then you have Santa Ana, which faces the highest poverty rate in the county. And so, anyway, this investigative reporter was looking into the connection between environmental toxins and the school to prison to deportation pipeline. So this is the idea that a toxic substance like lead, which wreaks havoc on children's cognitive development, can actually be linked to the pushing out of Black, Brown, Indigenous students within the public education system, pushing them into prisons, jails, and often into deportation processes. So it's a very real phenomenon that's playing out and is not often talked about. So this investigative reporter gathered data using a method that is rigorous, but considered by some perhaps to not be as rigorous when it comes to peer-reviewed methods. And she put out her report, which included community input, community knowledge, and she then presented the findings to the city of Santa Ana and healthcare officials, and there was practically no response. I can tell you that this happened in 2017, and to this day, there isn't an actual policy recommendation in the books to address toxic soil lead exposures. And so seeing that this initial work had such a poor response by those in power, my organization decided to partner with faculty and students at the University of California at Irvine, specifically in the public health program, as well as with the youth cooperative. So cooperative is a structure where there is no hierarchy. So it's a youth cooperative of young Latinx, we're talking middle school, high school age youth who live in Santa Ana, California, and who are organizing around solutions to food sovereignty, because again, the issue of food accessibility is a very significant issue in Santa Ana. So, we receive a recommendation from Physicians for Social Responsibility that if we really wanted to have a rigorous case and really present this issue, we needed to engage in peer-reviewed sample collection, but also sample analysis processes. So that's really where the benefit of working with academia came in, because they were really able to leverage their experiences in those fields to serve a community concern And again, I would say that our collaboration has been successful with academia because we're very fortunate to be working with researchers and students who really understand community engaged, community driven research projects and also anti-racism. I would imagine it would be extremely hard if the individuals that we work with were not the individuals that we're working with. And so, fast forward to 2020, we were able to sample every single census tract, every single land use in Santa Ana. And we found that, while the state of California puts the threshold for lead exposures at 80 parts per million, so that's the level when we start to see impacts in children's cognitive development. The range of soil exposure that we found goes from 12 parts per million to just under 2,400 parts per million, right? So we're talking about extremely high levels that families, children, everybody's being exposed to on a daily basis. And our public healthcare agency, our city government, has absolutely no response when it comes to it. And I wish I could give them the benefit of ignorance, but really, again, we reached out to them when we were designing our study and inviting them to partner with us. So there's if you want, you can go into the agenda minutes and you'll see that in 2018, we gave public testimony, inviting them to partner with us. And to date, there hasn't really been a response from them. So just to talk a little bit about, the partnership that we have with UC Irvine faculty, we're very fortunate to have that partnership. I think, again, what that type of relationship entails is that as a community-based organization, we have a very small budget. Our budget is around $160,000. It's very small. But there's no way that, we could do this type of work if it wasn't for our partnerships. We did some calculations of what it would cost to do this project if it were fully funded, which is not at this moment. If it were fully funded, it would cost about $250,000 a year, and this is a multi-year effort. And again, this is to fund, the researchers at the university, lab analysis, and also the community organizers. But right now, we're doing this work really in kind because we believe in it so much, and it's come at a sacrifice to our academic partners who've had to advocate. I'm sure many of you can relate. If you're doing this type of work, you have to actually advocate and fight to be able to do community engaged research. And it's also come at a sacrifice to us, having to figure out how to leverage our small resources towards, the vision that we have for this project. But we're resilient, we're hanging in there. What else can I say? In terms of our partnership, we meet on a biweekly basis to coordinate all aspects of our work, which include research, advocacy, and relationship building with the community members that participated in our soil testing. And as far as next steps with this project, we really are focusing on building out a community organizing campaign to get the city and the county to actually do something about environmental lead exposures. We know right now that what they're offering is not enough. In many ways, healthcare systems, the way that they actually play into mitigation and remediation of children's lead exposures, that at least in California, a family has to go to their primary healthcare provider and get their children tested for lead. And if that test comes up as positive, then that family may get referred to the public healthcare agency, who then will provide the family with brochures on how to clean up their homes a little bit better to get rid of, dust particles that may be traced with lead. Does that address the environmental lead crisis? Absolutely not. And, we can't even depend on the healthcare system to actually do that primary step, because in California, earlier this year, the Department of Public Health was audited, and it was found that they were severely undertesting children who are on Medi-Cal, they were severely under-testing them for lead. So again, when we talk about who's actually getting exposed to environmental pollution, it's working class people, it's people in poverty, it's undocumented people. In Santa Ana, it's majority Latinx people, and we know that there are hierarchies that play out even when you go visit your physician. We've had to actually draft a letter that we give to community members to take with them at their visit to say, hey, it's my right under the law to get tested for lead, because often physicians may not, in the 10 minutes that they have to spend with a patient, they may not take the request for a blood lead test seriously.
Yeah. So, Enrique, first of all, thanks for walking us through that example. There was so much that you gave us there. At the end, it really shows how the social determinants of health work that a lot of health systems are endeavoring to do has to even go beyond this, I guess, transactional resource connection piece. I think that can be a piece of it, but there also has to be work to understand the root causes of inequity within the system, especially if we're saying that we want to promote health equity. And we have to partner with the community to see how that can be elevated. And that has to be centered around the voices of those who are disproportionately affected. I think the partnership that you have with the research institution is amazing. But I guess I kind of cringed a little bit because I was like, dang, it takes a lot to elevate the community voice. The fact that you've been doing all this work, going to places where you're supposed to publicly engage, and still have ran into barriers. Amy, I want to bring you into the conversation, having so much experience in research institutions. Like, how do we start addressing some of these challenges of centering the affected population voice when we are seeing, even with Enrique doing such great work, the lengths he has to go to make sure that people take the community voice seriously?
Yeah, that's a great question. I think it's one that a lot of us in research institutions grapple with. I think Sheena mentioned there are systems that sort of keep academic research looking as traditional as it always has. We get credit in our CVs and our annual reviews for the number of peer-reviewed journal articles, the number of grants we receive. We don't get credit typically, although I'm happy to say it's not true in my institution, but we don't typically get credit for community partnerships, for building them over time, for nurturing them before, during, and after those grant awards. It's very challenging to be able to do that and meet the the promotional criteria of an academic institution. There are also systems of ethical oversight of research that we really need to think about. I spend a lot of time thinking about this because I am supporting residents in the Promise Zone, the West Philadelphia Promise Zone area of West Philadelphia, which immediately surrounds Drexel and University of Pennsylvania and other eds and meds, and is an historically low-income, predominantly Black community that has been economically excluded from the high-paying jobs and sort of the economic benefit of these surrounding eds and meds. And there are IRBs in both of those and many of the institutions around them that are supposed to oversee the ethical conduct of research. And to be quite honest, I think Enrique said, the system is just not prepared. It's not prepared to oversee the ethical conduct of research in communities. I mean, to be fair, they were designed to protect individual human subjects because of all Tuskegee and all of the historical abuses that we're aware of. They're not set up to protect or respond to the broader interests of communities. They lack capacity for community engagement themselves or participatory research approaches. They have sort of a tokenism approach typically to community perspectives. They're only required to have one community IRB representative. We know that that is not representing diverse community perspectives. And they're also not set up to address geographic concentrations of research, which is exactly what our community partners voice is their biggest concern. It's just this burden duplicative and, and not clearly beneficial research in their communities. So, we really need to examine within our academic and research institutions how the IRBs are working with community residents. So in the West Philadelphia Promise Zone, residents have created the Promise Zone Research Connection, attempting to create a community research review board where they will be the ones to review the research that is proposed to happen among their residents or within their borders. And you guys probably know the Community IRB or the Community Research Review Board model, but it experiences a lot of challenges. And so I see my role as an advisor to this group, and I think this is a great way for academic partners or research partners to think about how to be both, an insider and an outsider in this situation, in order to sort of bridge that gap and think of ways that the understanding that I have of these systems or the resources that I might be able to bring to this group can support their agenda. So in this case, it's been to try to look for funding opportunities for this group. Funding is challenging when it comes to trying to build the community's own system and capacity for research. There are no funding mechanisms that do this. They might support it in the context of a traditional research grant, where some community participatory research practices, hopefully some community research capacity building is occurring. But that's typically related to the outcomes or the priority areas that funder wants to fund. So around asthma or around lead abatement or whatever the case might be. But a community research review board wants to review research regardless of the topic. They want to be the gatekeepers to research that will occur in their community, and it could bridge many different sectors, many different types of funding. So that makes funding typically very difficult to get. There's also limited expertise of grant reviewers on this topic. When we apply for research funds, those reviewers don't understand that, the failure of the IRB system to protect community residents. They don't understand the detrimental effects of the power imbalances that we've been talking about between communities and research institutions. And then when we apply for program-focused funding mechanisms, the reviewers typically don't appreciate the role of a robust research infrastructure to drive those interventions or to be able to seek those outcomes. And then I'll just mention also that there are staffing challenges with this kind of community-led research experience. And, for this Community Research Review Board, there's staffing challenges, but this sort of speaks to a broader issue of there being a lack of career pipelines into research for residents of communities such as West Philadelphia. Despite the fact that they're surrounded by eds and meds, the youth in these schools are not typically prepared for careers in research or in medicine. And so researchers tend to rely on community volunteers to partner with, what I like to call the community advisory board or the focus group model of community engagement, which isn't about creating positions within research, creating sustainable research roles or organizations or infrastructure for them. And so that, of course, affects something like a community research review board, trying to find the funds to create the staff to be sustainable, to then liaise to what in Philadelphia we have 19 different IRBs of different institutions, for them to liaise to them, to build those relationships with researchers, to drive those researchers to their research review board meetings, to be able to be, true partners in reviewing their research and advocating that the research includes and benefits their community members. I think that this, thinking about these capacities, these communities as systems that we need to invest in just as much as we invest in our other research systems and institutions, sort of the capacity for their own governance and committee structure and engagement and training and staffing, as well as their ability to, interact with these more powerful institutions. We really need to think about, as academic partners or as partners from other large institutions, how we can try to bring whatever we can to support the lifting up of their systems to be able to be more equitable partners and important challengers, to sort of the research process as it exists right now. And I'm sorry, I think that was a long-winded answer.
Yeah, no, again, sort of like Enrique, you gave us a lot to work with. And, it's it's really interesting. You know, I appreciate you bringing up the staffing and how things are not staffed to, or systems are not staffed to center the community voice, and making sure that we're operating a research agenda from a community agenda. Mm-hmm. I also believe, and this is something that I really want to uplift, is this tokenism approach to community perspective that you mentioned earlier. And I think that especially within the social determinants of health sector, whether you're in healthcare or if you're a funder or if you're, you know, a community-based organization, there has to be work and a conversation to make sure that we're not creating a tokenism approach to community perspective in the work. That we have to have the community perspective, but again, going back to something even Enrique said, they're equals. You know, community members, people who are coming in who's sharing the lived experience. Because to be honest, even though I can separate, you know, like on this panel, I can say, hey, the community, but when we start talking about things that are affecting the Black, Brown, Indigenous communities, I'm a Black male. So if some people don't have that opportunity to even divorce themselves and say the community, the institution, and we have to be mindful of that. And then also, what are we honoring? So with social determinants of health metrics, oftentimes things are very health-centered. We talk about utilization of services a lot, inpatient admissions, but are we really, as much as we're looking at resource connections, are we looking at community partnerships and how many community partnerships that we're creating to make the system easier for folks? Like, these are things that people should really think through. And I can say that, you know, and bring Sheena in, because Sheena, we have a lot of conversations like this. I want to really uplift a question that I've seen a couple of times around preparing community residents to own their data narrative. And so I think that there is a question around, you know, what are good ways to share data back to the community, but there are also questions around how do we prepare communities to own their data narrative, and wondering if you could speak to that as well.
That's to me, right? Okay. Yeah, I'll start with it, because I think I saw some of the questions around data literacy and capacity building around that, and I can start with that and also kind of circle back to a point you and again, Amy were making that I think is super important. So in terms of data literacy, it's interesting because I think there are two perspectives that might seem opposite, but they actually converge. So I have worked with capacity building efforts in communities where, you know, folks had maybe third grade education in home country, and there's like lots of assumptions and some actual barriers around, you know, access to certain kinds of terms that are common in data analysis or data approaches, right, and methods. That being said, I really struggle with sometimes those assumptions because, you know, there's so much research and just basic people listening to people's stories that show that even regardless of education or literacy rates, that people are doing a lot of strategic prioritization, financial budget management, hard math in their daily lives, right? Just to survive, right? Because of the constraints of systems of oppression. And so, you know, is it even necessary? But does someone know what a logistic regression is? I don't know. And honestly, I have friends who have whatever PhDs in English literature. They don't know either, right? And so there's that level of like, yes, let's align on some common terms, or you know, sometimes even project to project or funder to funder. There's terms or things that we have to all kind of share definitions around and spend time getting to know and learn. And also, it's really important to engage in that time for capacity building as a shared experience. I can't tell you how many times backbone agencies have also said, I spend the majority of my time capacity building with executive directors at CBOs, right? It's so that they are in the right mindset and have the right skills, you know, to engage in collective impact or other similar type endeavors. And so I just kind of want to center on that too, because I think sometimes it's sort of like who needs help versus everybody kind of needs some time for capacity building in different ways. And also, what are the ways that we can come together and say, okay, how do you know if something is working for your child, right? And so when I ask that question, people will describe methodology, they will describe quality improvement, they will describe all of these things that we have perhaps fancier names for, right? But it's in there and it's actually happening. And so maybe the capacity building is around, okay, how will that translate or play out in terms of this project, right? And so I think I just want to kind of acknowledge, yes, there is time needed for capacity building and data literacy. And also, oftentimes, you are not actually starting from scratch. There are so many examples of people who maybe never had formal education and are tailors that people might say, oh, they don't know how to do math, right? But it's like they're doing really complicated algebra every day when they're doing alterations, right? And so I just kind of want to like name that in terms of data literacy and capacity building. And there's lots of great resources we can share afterwards that have good kind of community-based curricula around that. The other thing I wanted to circle back on was the importance of, starting with community members, people most impacted early on in determining what the units of study are going to be or what the area of study is going to be, and Mickey was sharing about Santa Ana and then some of the dominant narrative around Orange County being this white wealthy county, and Amy speaking specifically to a particular part of Philadelphia. And I think about even just this vague word that's become really popular around community and community engagement is, sometimes that's at a city level, is that at a neighborhood level, and also who is determining what that geographical meaningful unit is, right? Saying that, okay, it's going to be looking at data at the city level when we know something is really important to look at a neighborhood level, right? And I think some of that is just very technical in terms of like mapping or data sets, but actually there's a deeper thing happening there, which is that there are external people making definitions versus internal decisions when you spend time for making, designing the study together or designing the project together, where people can say it's really important we look at the neighborhood level on these zip codes or something like that, from this street to this street, because that takes place in a broader history of erasure, right? And I think, Enrique, I was thinking about a passing conversation we had months ago where there was actual budget for addressing environmental justice issues, and people were saying, oh, but we don't have poor people here. We don't have like any issues here because we're Orange County and we're wealthy. And it's like, no, you're wealthy. And so just even like when you were sharing the story of Santa Ana and thinking about erasure, right, and how that looks in terms of geographies and catchment areas and data, and that also kind of connects to, maybe they need some data literacy capacity building as well.
Thanks for sharing that, Sheena. I'm glad that you centered us, and we do sometimes have a paternalistic view of like who needs support and who don't, who does not need support. And I think, especially in today's environment, we all have some work to do, especially when it comes to putting on an anti-racism lens, because it's so ingrained in how we have moved throughout systems. And so the need for data literacy, that capacity building, if I'm hearing you correctly, we're going to have to think about that from every perspective, and not just, really shaping it to the affected population. And we are going to benefit in doing that capacity building with the affected population. I also loved you kind of really referring to scoping out, especially if you're wanting to report out data to the community. You need that affected population to help you scope out who the community is. And is that, the neighborhood, certain zip codes? Is it the whole city? And so using really talking to the affected population to help you even think through the communication strategy of sharing results. I think a lot of people want to know just how to start. And there's a question that says, how would you propose to engage the existing power structure to begin this type of conversation and push this type of agenda forward? And there are some recommendations. Sheena, I think you mentioned that there are different papers that are out, and people are wondering what are some specific papers that can give recommended next steps. So I'm opening that up to any of you, just so we can get through a few more questions. We can keep the responses, a little brief, just so we can get through the conversation. Not wanting to cut off anybody's great points, but just trying to get through as many questions as possible. I'm going to start with Amy. Go ahead.
Okay. I was just unmuting myself. I just want to give a shout out to Community Campus Partnerships for Health. They have an inventory of resources around both toolkits and trainings on community-based participatory research approaches. And what I love about their resources is that they have them peer-reviewed by both researchers and community-based organizations throughout the country. So I think that's an excellent place to start. There are some great toolkits I know that we'll also be sharing after this. But I'll just say from the academic researcher perspective, we need to start by engaging well before the research question creation process. We need to be building capacity together in a co-learning experience, because researchers need to learn cultural humility. They need to listen. We need to develop a shared language. We need to recognize the expertise in the community. And so all of those precursors to even being able to co-create research that's representative and useful for community agendas needs to happen well before we write a grant together. So I think that's how we start. We start by creating the systems where we can develop those relationships, that shared language together.
Enrique, I would love to hear your thoughts on where people should start, especially given your perspective.
Yeah, so I'm happy to link or provide links to two peer-reviewed articles that our Soil-Led Collaborative has published today. So one explores the state of soil-led policies in Santa Ana and, discusses how there's a lack and how that poses implications for public health. And the second paper really discusses the analysis on the samples that we tested. And there's some context in there that discusses the formation of our collaborative, which might be useful to people who want to engage in similar efforts. So you may be asking yourself, how can I, as a person within an institution, work with communities? I'm happy to offer our work as an example. If it inspires you or if it's useful, please go ahead and reference it. I also think that we're in an unprecedented political uprising and moment, and it's really a question of exploring. We all have good intentions here, and we all, I would say everybody on this webinar wants to really help the community and support the community. And really the question of data democratization is about power. And so to bring in the political again, how do we, as people with varying degrees of privilege, how do we reflect on our own privilege and the power that we possess? And how do we really leverage our voices to be in service with communities, right? And sometimes because there's a lot of complexities in this work. And there's concrete steps that we can take now, as you're talking about, allocating budgets for research. How do you make sure that community engaged research is not tangential to a project, but is actually the foundation of a project? And I really offer that perspective from the place of somebody who's working to change systems, transform systems. And I think, what this what this talk is teaching me is that we really need to be thinking about how do we actually develop healthier processes of working with communities to tackle these myriad issues that are impacting us at multiple levels. And I would recommend that it starts by thinking critically, about our own roles in supporting the status quo and recognizing that it is a practice. It is a practice to liberate oneself and to think critically about our role in the system. It doesn't mean that we have to then get stuck in despair, but really, see it as an opportunity to really step into courage and advocate for and with communities to make sure that they're at the table.
Thank you so much for that. I felt really convicted, Enrique, when you were talking, especially as we're talking about in the context of social determinants of health interventions, which all of you have, really talked about and really talked about root causes of health inequity. That we who are doing this type of work have to continuously reflect, and that is the process of liberation. That we have to continuously reflect on how we contribute to systems of inequity, and also reflect on our privilege and how that privilege can be used in service with and for communities. Another tactical question, Sheena, because Amy brought up kind of the need to kind of have this collaborative education when it comes to this type of work. And, I think that even with social determinants of health, we're doing continuous improvement to learn on it, learn about improving social determinants of health work each and every day. So how do we integrate kind of this data democratization within improvement work, when it comes to improving the social determinants of health initiatives that may be going on within health systems?
That's a great question. It's really interesting because earlier this year, we were having conversations with one of our partners that is deeply rooted in the community and neighborhoods of East Oakland, right? And it was sort of like, do we want to do a research project? There's grant funding for it. What kind of methodology should we use, right? The standard sort of questions. And it was around, understanding the impact of particular social determinants of health, resource and referral and intervention. And the thing, more than the actual proposal, what I found really insightful about the process is that as we were discussing, we moved away from anything that would be kind of like, it needs to be this large a sample size and run for, this amount of time to have any kind of statistically significant data, and that it would have to be this group receiving social needs referrals or essential needs referrals, and this group not, right? Because that's, first of all, everybody needs it, and so that didn't seem ethical. And also would have required going for a long period of time and sort of dividing groups in a way that just didn't make sense for this particular community and for the representatives that were speaking about it. And so, one of the things that really was attractive was actually more of a quality improvement approach. And that's to say, just because one methodology might be challenging doesn't mean, no methodology, right? Like, there's always methodology, right? And so with the quality improvement approach and continuous quality improvement, it's interesting that it was a good resonating methodology because it's about starting small. It's about not rolling out, for months without making a determination. You start with one person, 5 people, and see if something is working. You make tweaks, you make refinements, and then you continue to scale stepwise from there, right? And so, without getting into the weeds, I think that's where quality improvement or continuous improvement can be really useful. It's very practical because, and it's also a means of listening to people, right? So just even that act of, if someone says, hey, this screener makes no sense to me, and I'll tell you why, because your demographic categories is not how I identify this. I don't know who identifies in these categories, right? Like I can't even get past this, right? This question makes no sense, right? And so why distribute 2,000 of those if someone tells you that, right? And can tell you, like, this makes no sense, I'm not even going to fill it out correctly. And circling back to what Amy was saying, it's inaccurate then, right, to proceed. And so I think that's where, you know, those kinds of methods that we do have available to us can actually help think about relationship and power dynamics in a different way.
Thank you so much for that, Sheena. You really have shown that quality improvement projects may be a great testing ground for us to introduce data democratization, because you're literally improving on the intervention and using community feedback to make the project more community-centered. And I'm really appreciative of how you outlined that. We are unfortunately, you know, at time. I tried to get to as many questions as possible. Sorry if I missed your question, but, you know, I just want to wrap us up. Really, thank you for just talking about why data democratization is needed and is essential to the work today. And some of the things that I'm taking away from this is, one, that all of us need to be reflecting on our privilege, and reflecting on how we can be in service with and for communities. And we will reflect on our privilege. It also shows our need and our gaps when it comes to this space, and that we should be really looking to build our own capacity within ourselves, but also within our institutions, to bring people into the process, to promote data democratization, to center the perspectives of the affected population. We also have to advocate for what we value when it comes to the social determinants of health interventions. Are we valuing honoring community partnerships? You know, are we really thinking through how do we advocate for new funding mechanisms? Are we creating partnerships between research institutions and even health institutions to elevate the voice and the data that we get from community members? And how do we all use this to just further advance a community agenda? You know, we should be in this work to truly meet the needs of the community. And I just want to end on what Amy says. If we're not including the community in our data set, or if we're not including them in helping us shape the data agenda, then our data is literally not valid. So I want us to really think through that and interrogate that as we go into our workplaces and start pursuing these new initiatives that are well-intentioned, but we want to make sure that we're not perpetuating systemic oppression and systemic racism. So Sheena, Enrique, Amy, thanks for having this discussion today. The recording will be provided. We will be sending out links to the resources that Amy, Sheena, and Enrique referenced. And please look forward to the next webinar in our series that will be focused on evaluation. Thank you so much, and I hope you all have a great day.